Hello, my name is Caitlin and I am from the REACH study team. Thank you for being a part of the REACH study. I'm going to walk you step by step through the stool sample collection process. We collect stool because it lets us measure your microbiome, or the healthy bacteria you naturally have in your body. Before we get into specific instructions, we wanted to note if the stool sample is not your usual stool, diarrhea, or watery, wait to collect until bowel movements return to what is typical for you before collecting the sample. If this applies to you, please let a REACH team member know at your next REACH appointment. We will now walk you through everything that you received in your sample collection kit and the supplies you need to do the stool collection. Specific items in the kit you received may be different than what is shown in this video. If you have a history of asthma or allergies, the kit you received may also be different than the one in this video. First, let's get the sample kit that you received in the mail. Remove the large plastic bag from the mailer and take a look at the label on the bag. This label tells you what is included in the kit, why we are collecting these samples, and what to do before your next appointment. When you take everything out of your kit, you should find these items: stool kit, hair kit, vaginal swab kit, a green sample collection slip, and ice pack. Make sure you have all the contents in your late pregnancy kit. If you don't, please contact REACH staff. If you have already completed one of the other sample collections, you may already have removed some items from the kit. Find the plastic bag labeled Stool Scoop and Swab Collection for Mom and review the label. Remove the contents and the green slip of paper from your kit. Before we move on to collecting a stool sample, here are a few things to note. For this sample collection, you will want to wait until you feel like you need to have a bowel movement before setting things up. If you are collecting your sample a day or more before your REACH appointment, please place your ice packs in the freezer for at least 12 hours. You will be collecting stool into 2 different collection tubes. The liquid inside the clear collection tube is harmful if it is swallowed or eaten. Keep out of reach of children and pets. If the liquid gets on your skin, please wash your hands and contact a REACH team member, and we will send you a new stool swab collection kit. Please follow along as we walk you through securing the paper hat to the toilet. Now that you are ready to collect your stool sample, you will need to place the provided stool hat in the toilet bowl, which will catch the stool. Once you have completed your bowel movement, please stand up to wipe to prevent the toilet paper from falling into the hat. Then, toss the toilet paper into the toilet, either in front or in back of the hat, or into the trash can. Open the white pad. Open the swab. Do not remove the swab from the packaging until it's time to swab the stool. Then, put on the gloves that were provided in the kit. Remove the cap from the clear collection tube with liquid and place the cap on a flat surface. Hold the tube with one hand. Make sure all liquid stays inside the collection tube. Using your other hand, remove the swab from the package, only touching the upper half of the swab handle. For the stool swab collection, Coat the swab with a thin layer of stool and make sure there are no chunks of stool. Also, make sure that the stool doesn't get on the plastic handle. You will then drag the swab through the stool to lightly coat the swab. Then, put the swab into the clear collection tube and smush the swab around the sides of the tube. Place the swab into the tube and break off the handle by bending the handle against the rim of the tube. Discard the handle in the trash and close the top of the tube. Ensure the top is on correctly and tightly. Your last step of the stool swab collection is to shake the tube with the swab in it for 30 seconds to mix the stool and liquid. Next, we will complete the brown top sample collection. Remove the brown lid from the sample collection tube. Attached to the lid is the scoop. Collect several scoops of stool and place into the collection tube and then recap the tube. For the stool scoop collection, fill the brown cap tube about halfway. To discard the stool hat, separate the paper bowl from the cardboard holder. You can dispose of the cardboard in the trash and the paper bowl can be flushed in the toilet. Then place both collection tubes into the clear biohazard bag and seal the bag. Place the biohazard bag into the black Reach cooler bag. Please discard your gloves and wash your hands. But wait, there's just a few more steps. Please locate the green sample collection sheet and record the date and time you collected your stool. Please locate the stool survey and fill that out. Once you have recorded the information on the sheet and survey, please place both papers into the black Reach cooler bag. If you collected the samples earlier than the day before your appointment, place the black Reach cooler bag containing the samples into your refrigerator. Please be sure to bring the black Reach cooler bag to your next Reach appointment. The day of your Reach appointment, place the frozen ice pack into the Reach cooler bag to transport your samples. Thank you for being a part of the Reach study. Your stool sample is important to us, and because of your contributions, we can continue the research we are doing. If you have any questions, please reach out at 313-874-3151.